Hello, it's Tessa, one of the news editors here at Manx Radio, back with you for another episode of Newscast. Today we're talking cardiology, and cardiology appointments to be precise. We know that this is an issue which has affected lots of our listeners, and hopefully this episode of Newscast will bring you some good news. If you were one of the many cardiology patients who had your upcoming appointment cancelled at short notice, well, newsflash, it's being reinstated. That's the pledge from Manx Care, which has apologised after an administration error saw people told they'd have to wait until this time next year to see a doctor. The health body had initially blamed capacity issues for having to cancel a number of clinics. Well, we've dug into that a little deeper and unpicked what exactly is a capacity issue. Manx Care has told us that it was due to a doctor who oversaw clinics on a Monday and Wednesday leaving the service. Clinics in the interim between that doctor leaving and a new doctor starting in the next couple of weeks were supposed to be shelved. But, and here's the but, due to an administration error, what actually happened was appointments up to the end of 2023 were pulled instead. I've been speaking to the Chief Executive, Teresa Cope.
We had a middle grade doctor, so a non-consultant grade doctor who was supporting the cardiology service, but that doctor left in the summer, so we have had a gap that we have been filling on a short-term basis, and we have a new middle grade doctor starting in a few weeks' time who's able to take those clinics. So we have had a capacity issue around one of our middle grade doctors, which resulted in us not being able to staff two clinics every week, the Monday afternoon clinic and the Wednesday afternoon clinic. So that resulted in some patients having to be cancelled. Now, what we know is that an error in our administrative processes meant that those two clinics for the whole of the year were cancelled in error. And that's the point that I really wanted to stress. This was an error on our part, and we're really sorry for the distress that it caused. What has happened as a consequence of that is that we do have a new doctor starting who will be able to fulfil those clinics on a Monday and a Wednesday afternoon within the next 4 weeks. But in the short term, our current consultants are able to pick up that work. So they've kindly agreed to do extra sessions, which means that we can reinstate those clinics from next week. So if patients did have an appointment from next week, that will be reinstated, and our clinical administration teams will be contacting patients just to confirm that if they had an appointment for next week, that will still exist. Those clinics have been reinstated.
And obviously we know that many patients were sent letters with new appointments on that went way into 2024. Is that an administration error as well, or have they also got appointments almost a year away, or in some cases more than a year away?
All our clinics are always fully booked, and there is very limited spare capacity. So that would have been the next available slot. But what we have said is that we would reinstate those clinics rather than having to book patients so far in advance. So yes, those clinics will be reinstated, and all of those patients' original appointments will be put back into place.
The issue has certainly struck a nerve with you, our listeners. Many of you have been in touch to tell us how frustrated you felt when your appointment was cancelled and you got a new one for 2024. The next person you'll hear from is Paul Hay. He's a painter and decorator on the Isle of Man, but he's currently not working because he's waiting to be seen by the cardiology team. He suffers from pericarditis, a condition which causes inflammation of the lining around the heart. He also has costochondritis, which is inflammation of the connective tissues attached to the sternum. The 49-year-old was due to be seen in the cardiology one-stop clinic on the 11th of October, and that came after a previous follow-up appointment was cancelled 18 months ago.
I currently can't work because I'm a painter and decorator. If I work with my arms above my head, I get massive chest pains down my arm, under my armpit, get short of breath, feel like passing out. So it's major. Even the cancellation of the appointment on the day of the appointment, and I literally got a phone call at 9 o'clock in the morning saying, I'm sorry, the cardiologists are sick, which is obviously a false statement, so I don't know why they told me that in the first place. The stress and anxiety it caused me all weekend obviously caused me pain, so I felt ill all weekend because of it.
And how does that actually make you feel, knowing that you were due to have an appointment and it's been cancelled at the last minute after quite a significant amount of time of being on the waiting list?
Upset, and then once I'm past being upset, I'm angry. For me, it seems like they haven't checked my medical records, because why would you cancel someone's appointment who's currently suffering from a heart condition? If I was an 83-year-old Mary from Port Erin, who maybe not fully compass mentis, she might just accept that. But that might cost her life. Does that then mean that Manx Care are then failing in the duty of care they've got with their patients, with the islanders, with the residents of the island?
Do you know roughly when your appointment is being rescheduled to at all?
My appointment has been rescheduled from the 11th of October 2023 to Friday the 25th of October 2024.
So that's more than a year away. I mean, is that good enough? Are you satisfied with that?
Oh, not in the slightest. I shouldn't have to wait any longer at all. I should have been seen well before now.
And obviously you are 49 years old, which means that you are still within working age. How is this actually affecting you, knowing that you're not being seen and you're not able to work because you can't be treated?
Well, I don't have an endless pit of money. I'm completely dependent on my wife now, who is actually a specialist nurse as well, and she is shocked at the care, absolutely disgusted at the care.
That's Paul's story, and he's not alone. Lots of you left comments on our Facebook page. Zoe said her mother, who's in her 80s, had been waiting 2 years for an appointment, describing the service as disgraceful. Sonia said people should be sent to a specialist hospital in Liverpool instead, and Suzanne branded it disgraceful and shameful, adding, I know several people who are really scared that if they become ill, that will be curtains. They have no faith in Manx Care at all. The upset and distress caused is something Chief Executive Teresa Cope told me she wanted to apologise for on behalf of the organisation.
We're very, very sorry. We know that the cardiology waiting list is long. We inherited a very long waiting list after COVID. We have invested in additional cardiologists. We're currently out to advert for another cardiologist to join our team. But we are sorry that, both we've had a long wait for appointments, but also this will have caused additional anxiety and stress for patients as they've had an appointment cancelled and potentially booked so far in advance, which potentially could have left them waiting a further year for their appointment. So I'm pleased that we have been able to get the full support of our cardiology team to reinstate all of those clinics so everybody can have their appointment that they had been scheduled to have over the forthcoming weeks and months. And the small number of patients who've had their clinic appointment cancelled this week, of about 20 patients affected, will be reinstated and have their appointment within the next 2 to 3 weeks.
One question, I suppose, that got asked when this was sort of bubbling away was whether people could actually be sent to the UK for treatment. Is that ever an option? Is that something that Manx Care could look at if we are sort of seeing longer waiting lists in certain specialities?
Potentially, yes, but we already send specialist cardiology activity across to the UK. So if patients can't have their service here, it's more of a specialist nature, then those patients are referred across to the UK for that service. What I do know is, whilst our waiting lists are long, the waiting lists in the UK are just as long, if not longer. So just by referring somebody into a UK service does not always mean they are going to be seen any sooner.
People this week have been very concerned about, they obviously want to come to the appointments that have been booked, but obviously there will be, as I'm sure there is across all specialties, people that just don't turn up when they do have an appointment, and then that effectively goes to waste.
Yes. So the organisation as a whole across all of our specialties has a DNA rate of about 10%. So about 1 in 10 patients do not turn up for their appointment. And there are all sorts of reasons for that. But one of the reasons that we think and that we're responsible for is that we often plan appointments too far in advance. So people forget. So we had a practice previously of scheduling appointments up to a year in advance, and that isn't helpful. People do forget, and things do change. And also the hospital, when you plan that far in advance, you do not know the capacity you're going to have. So often appointments end up being cancelled and rescheduled multiple times. So that isn't an efficient way of working. We're changing the way we are doing our bookings, which means that we will book people's appointments 6 weeks in advance. That aligns with when we know we have capacity. So if a consultant is on leave, for example, our policy is that they give 6 weeks notice. So we can be certain that clinic is going to go ahead and is unlikely to be cancelled. So in the future, our new booking system will be that we will just book people's appointments 6 weeks in advance. Obviously, if they can't make that appointment, they can call us and we can reschedule that. But I'm hoping this practice really helps to give people that certainty about when their appointment is, have a fixed date, have greater certainty that appointment is not going to be cancelled, and also reduce the DNA rate. So whilst it's 10% across all specialties, the DNA rate, which is very high, and we should be aiming for about 3 to 4%, the DNA rate in cardiology is around 30%. And we think this is because we've been booking appointments far too far in advance and patients have been subject to multiple appointment changes. So it's entirely reasonable that patients have been confused by how many cancellations and rescheduling that's had. So that's not helpful for anybody. But clearly, we can't afford to have 30% of a do not attend rate within our services.
I know also that there was talk about the text message reminder service that Manx Care offers. I did see a comment the other week about the fact that the text messages that are sent out aren't personalised to the department of which you've got an appointment. So, for instance, if I'm having a blood test, I'll get a reminder, but it won't say the blood clinic. It will just say you've got an appointment. Is that something that you're sort of aware of and also looking at? Is that something that perhaps could help having that additional reminder system for people?
Yes, it is what we're looking at as well, and also working with the Information Commissioner as to this sort of opt-in and opt-out service. Clearly, we need to make sure we've always got the right contact details, so we always have your right mobile details on our records, so making sure if there are any changes, we've been updated on that. But also just making sure that we can have the opt-in, so people giving permission to be subject to our text reminder services. So that's really important, and being able to provide more information about what that appointment looks like. So that is working with the Information Commissioner within the GDPR rules and just making sure that we can tighten that up. So yes, that's part of what we're looking at too.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.